Good.
Okay, how are we doing, Karen? Okay, great.
How does this? Oh, this is.
Okay, ladies and gentlemen, I think we'd like to get started. I hate to break up these very productive-looking side conversations, but nevertheless, we have a lot to talk about today. I want to welcome you all to the Woodrow Wilson Center. My name's Jeff DeBelko, and I am fortunate enough to direct our Environmental Change and Security Program. On behalf of former Congressman Lee Hamilton, our President-Director, it's my great pleasure to welcome you all to the formal memorial to Woodrow Wilson. Congress decided that because Wilson was our only president who had a PhD, that the worlds of scholarship and the worlds of policy should come together to form his memorial in the form of a living institute that brings these worlds together and discusses the best in research and the best in policy and try to learn from one another and improve each other's endeavors. And I think you will find that our Fishing for Families in the Philippines session today is exactly this mission that we're trying to pursue, trying to bring the newest of research based on field-based activities into a policy setting so that a mix of policy people and practitioners can better understand the impacts of their interventions and their activities and base that on research and go forward and try to adjust and scale up those activities in ways that are productive. It's something that we've been trying to do here within the Environmental Change and Security Program now for 14 years, be this information clearinghouse and be a place where lessons learned from the field can come together and have this exchange, particularly focusing on issues of environment, population, health, development, and even how those issues are both connected themselves, but how they connect as well to our broader foreign, diplomatic, and even security policy at times. It is, again, my opportunity to say thank you to USAID's Office of Population and Reproductive Health that this meeting, like many of our meetings, is made possible with their support, and it is something that we appreciate a great deal, that this office is most interested in not just kind of a narrow definition of their issues, but is really kind of forward-leaning and interested in seeing how the issues of population and reproductive health connect to a range of issues, and we'll see how that in this development and conservation environment context is certainly the case today. It's a great pleasure to welcome back to the Wilson Center Leona D'Agnes, a person that's known to many of you as really one of the folks who is truly expert, and that's kind of both book smart and field smart, on how these population health environment development issues play out. You will have picked up her biography along with the participants list. And you'll see that she's been quite active in many parts of the world, particularly Southeast Asia, and we'll hear a lot about her longtime work with PATH and PATH Philippines and the IPOP Corn program with a focus on Philippines. She's now a little farther north and west working on issues in Nepal, but some of these same integrated approaches and applying some of the lessons learned there in program design. So it's terrific that Leona, while in Washington, is willing to share what are some results that, frankly, in this room we've often said this is exactly what we need, which is some experiences drawn from field-based work, but that also kind of took the time and really the additional effort to do some controlled comparisons and understand what integrated work means versus single sector interventions. And so we really look forward to the work that Leona and her colleagues have done on this and sharing her insights. I should say we liked it so much that we asked them to contribute a piece to our focus series that Leona and Joanne Castro, who also has been here before, can't join us today, but have penned. And I hope you will pick this up and read it and use it and share it, and you'll find it on our website as well. So it's terrific, and we thank them very much for sharing their insights with us in this forum. So with that, I'd like to turn it over to Leona, and we'll have her presentation, and then we'll have an active Q&A. I should say that we are webcasting today's event to share this with folks outside the room. And in fact, I think notably some of the longtime supporters of this issue generally, and even this project, folks at the Packard Foundation, Population Reference Bureau, and of course USAID, are able to tune in online. And so it's a thrill that they're able to join us. I should say to online viewers, the PowerPoint slides that Leona will be presenting are available on the website. So it will be much easier for you to see them if you just download that file and follow along during her presentation. When it comes to the Q&A, I ask that you wait for one of my colleagues to come with a microphone, and if you could identify yourself and pose your question that way, then the folks online will know who's asking the question and what they're saying, as well as all of us. So, Leona, please, the floor is yours.
Thank you, Jeff, for a very warm welcome, and to all of your staff who've really done so much over the past 2 years to work with us on this focus piece, as well as a number of other events where we're trying to disseminate as much as we can the experience of this 7-year project, which is called the Integrated Population and Coastal Resource Management Project. We call it iPopcorn, and if it sounds like popcorn, it's meant to sound like popcorn, because we have learned from working with Mr. Michai Veeravidya, who some of you know is the condom king in Thailand and the recent recipient of the Gates Foundation Global Health Award. He is a member of our board of directors, and my husband Tom, who's here. Tom, where are you?
He's hiding over here.
He's supposed to cue me when I need to move on in my discussion. Had the privilege of working with Michai and his foundation in Thailand in 1978 to 1981. And Michai always told us that you need to bring some fun into development work, and particularly with family planning. So, and the Filipinos are fun-loving people, and they love acronyms, and so we purposely chose this to sound like popcorn. And it went over really well in the villages, and later on we even found that it was a way that policymakers could show their support for family planning and reproductive health, which is extremely controversial in the Philippines. They could show their support by saying, I support iPopcorn, without being attacked for supporting family planning. So that was something that we hadn't envisioned. We thought this would be something that the communities would like and be interested, but it turned out to be an extremely important policy, advocacy, communication tool as well. Today I'm going to try to give you some information about the program itself, but I wanted to spend more time on the research, the operations research component, because there is a lot of interest in this, and we just now have the data. We're preparing an article that could potentially be published in a peer-reviewed journal, so I'm sort of pre-testing this out on you now. So the actual project started in the year 2000 when the David and Lucille Packard Foundation gave Path Foundation Philippines, which is an independent NGO that had an affiliation with Path International for many years, but they were always established as an independent foundation. Packard gave a participatory planning grant that allowed Path Philippines to bring together experts in the conservation field and the population field to kind of brainstorm how we should do an integrated approach and where we should do it and what would be the elements of it. And so I want to give a lot of recognition here and thanks to the Packard Foundation, because they started us in 2000 and they're still with us until this day. And not only in this study, but in funding the scale-up. This approach, which I'm going to describe to you, has been scaled up to over 1,000 fishing villages in the Philippines, and working with 33 local governments who have bought into this and co-financed those scale-ups. And they were instrumental in getting us started. And then USAID, Mr. Tom Outlaw, when he used to work for, I don't think it was called the Global Health Program then, it was Population Reproductive Health Office. He saw the potential, and he also provided some very critical funding in 2002, which allowed us to go beyond the 2 ecosystems where we were working and basically introduce this approach to half of all of the most critical marine conservation ecosystems in the Philippines. So there are 14 that are considered to be the top priority for conservation of marine biodiversity. And in the 7-year period, we've been able to introduce this approach into half of them. And USAID played a big role in helping to finance that replication and scale up. Also, the USAID Philippines office has a fisheries improvement project, and they had followed early on the success of our pilot, and they put a component in their fisheries management project that included population and family planning, and it was through that project also that we were able to scale up in several other important marine corridors in the Philippines. So I'd like to also give special recognition to USAID Philippines for having that vision. Lastly, I mentioned Michai's group in Thailand. He also has played a really important role in helping us because we realized when we started doing research in fishing villages to design this project that there was no way that we were going to be able to get family planning services into these remote areas where sometimes there's no roads and you have to go by small boats, and the government health worker midwife might only get in there once a month, and when the high seas come they can't get in there for months on end. So we realized that there was no way that we could provide access to not only family planning but conservation know-how and microcredit, which is also an important component because these are the poorest of the poor. Fishermen are the poorest of the poor in the Philippines. We had to use community-based approaches. And the Philippines does not do community-based family planning. It's not part of, they don't have a population policy, as many of you know, and this is partly why it's difficult to do work there. But unlike Thailand, where they've been doing community-based family planning for 30 years, and by that I mean training people from the community to use simple tools and methodologies to be able to screen men and women who want to use contraceptives and counsel them and actually provide them with certain methods, non-clinical methods. That's what we mean by community-based family planning. There's also a similar community-based strategy in coastal resource management. The other side of this, the popcorn side, is there are things that the community can do itself to restore a fisheries that's collapsing. And fish are so important in the Philippines, and we'll get into some of these slides now, because 80% of the protein requirements in these rural fishing villages are from fish that are just caught in small fisheries that are called municipal fisheries. The nation on a whole, 50% of the protein of the whole Philippines population comes from fish. So fish is an important staple product. And that's why we say it's iPopcorn for food security. So the program is really focusing on food security. We're not just out there trying to promote family planning or conservation. We're saying that we are promoting an integrated approach that is to help improve food security. As many of you know, it's an archipelago country and it has over 7,000 islands. And they just finished the 2007 census data, and they've come out with some of the statistics, and there's now 88.6 million people in the Philippines, and in 1990 there was only 60 million. They have been able to reduce their growth rate somewhat, so it came down from 2.3% in 2000 when we first started doing our surveys, and it's now about 2.04%. That's still one of the highest growth rates in all of Southeast Asia, so it's still very high. They don't have the most up-to-date statistic on what percentage of the population is under 15. This is where you get an idea of what is the youth bulge in a population. It was 37% in 2000, and I think it's probably going to be up to 40% when they finally release the 2007 data. This has an important implication because the demographers have actually looked at population projections, and they can say what's going to drive future growth in the Philippines population. And 65% of that is going to come from this age group, 15 years and younger. So that's what gives the momentum in a population. And another 17% of future population growth will come from married couples who want to have more children, desired fertility, that's called. And then the other 18% will come from women who really don't want to have any more children, but they're not using family planning for one reason or another. They don't have access to methods, which is mostly the case in these rural coastal areas, and other reasons. But 65% is going to come from this age group right now that's 0 to 15. That's also where you're going to see the growth in the pressure on ecosystems and coastal habitats and terrestrial habitats. That's where you're going to have this driven pressure also by the youth bulge. So when we did our analysis on this program, we realized from the beginning that to be ahead of the curve, we wanted to be ahead of the curve. We didn't want to just be in there providing services to adults. We knew now that we had to do something to engage this younger age group that's going to be the future stewards of the environment and the future parents of children. So we structured the program to have a large youth component, and you'll hear more about that. I just wanted to show you kind of the comparisons of what the population is like when you focus on the coastal zone. 60% of all Filipinos live in the coastal zone, and there you'll see a much higher rate of population growth, up to almost 4%. And most of the coastal zone is rural, although there are several cities that are also on the coastal zone. But the population density is much higher than the average population density in the Philippines. So you've got 286 persons per square kilometer on average in the coastal zone. Now, if we look at, though, if you just go down to what I'm calling the marine hotspot areas, if you look further down to the areas where you have high marine biodiversity, there's over 500 people per square kilometer. Population density is twice the national average in these areas. You have population growth rates of 5.6%. Tawi-Tawi is a province in Mindanao. It has 25% of the remaining coral reef in the country. It's also got the highest population growth rates, the highest population density, and the lowest rates of family planning practice, the lowest levels of knowledge about conservation. So when you take it down and really focus on critical ecosystems, we call them hotspots because they have two dynamics: this high population growth, high momentum in the population, high biodiversity, but also very high threats to the biodiversity. And to go back over the environmental facts, as many of you know, the Philippines is one of 17 megadiverse countries in the world. And it has recently, through studies, been identified as the global epicenter of marine biodiversity. The center of speciation of coral that has been identified now in the Philippines. And it's also one of the most imperiled environments in the world, and studies have shown this very high environmental stress due to the population factor. And when I talk about population, I just don't mean high fertility. That's one element, but there's also high migration. And these areas of biodiversity are magnets. They attract people, and there's a lot of migrants that come there because they can glean from the fisheries, they can cut wood, get mangrove forests, they can extract and get free goods, basically. So part of the population growth is because you have high immigration into these areas as well. So in 1998, when some studies have been done, they found out now there's only 5% of the coral reef remaining in the Philippines that would be considered to be in very good or excellent condition. So they've lost a lot of biodiversity and species, both terrestrial and marine. I mentioned to you how this is a fishing-dependent country, and not only is fish the primary source of protein, but about 1 million people are involved either as small-scale fishers or commercial fishers, and that provides about 5% of the national labor force, and contributes about $1.3 billion annually to the economy. And over the years, there's been a tremendous increase in demand for fish, from the population growth itself, but also from international markets. And the Philippines is big tuna fishing industries there. And just recently, this chart was produced by the USAID Philippines Fish Project, it's called. And they looked at the trends, annual trends in marine fisheries harvest and population growth trends. And you can see from this chart that in 1995, basically, the population started to outgrow the annual fish harvest. And there's a limit to how much technology or better extraction you can do to try to increase harvest. And the World Bank has said now that they've already reached the levels. They're 30 to 50% higher fishing extraction than the natural production capacity of fisheries. So they've pretty much now outgrown their fisheries. And this is the beginning of what you would call a crisis in food fish security. And that's, the government has acknowledged that. So not only do we have consumer demand putting pressure on the fisheries that brings about some degradation of the ecosystems, but then we have destructive fishing going on there. And that's because there's a lot of demand for live fish. There's a big live fish trade. There's an ornamental fish trade. The United States is the largest consumer of ornamental fish from the Philippines. And thank you for your Finding Nemo article. We try to discourage people from buying ornamental fish because they use destructive methods to capture those ornamental fish, and we'll talk about that a little bit later. But one of the most popular methods is blast fishing or dynamite fishing, and that you can see the photo here where this little fisher, small-scale fisher, has thrown some explosives into the water, and it kills a lot of fish, and they come to the service, and he can harvest them very quickly. It also destroys the coral reef and other structures there. Dynamite fishing was actually introduced in the Philippines during World War II, and it was the Japanese soldiers who first started using the dynamite that they had access to harvest fish. And this chart will basically shows you something different from the other one. This is just focusing on what they call municipal fisheries. This is where the artisanal or the subsistence fishers fish. And it's 15 kilometers around an island are considered the municipal waters. And those are supposed to be reserved for small fishers. So the Fisheries Code of the Philippines gives preferential access to small-scale fishers and subsistence fishers into these waters. But it's difficult to enforce, and the local governments don't enforce it. And you've got a lot of commercial boats coming in poaching fish that's supposed to be for these small-scale fishers. So destructive practices and illegal poaching have basically depleted the fish stocks in these waters that most of the fishing communities depend upon for their food and their livelihood. So this chart shows how the daily catch rate has declined since post-World War II. And at the same time, the population has expanded 8 times while the catch rate has gone down 5 times. And this prompted the government, and through a USAID project called Coastal Resource Management for Food Security, to acknowledge, and it wasn't the president that acknowledged this, but it was the Department of Environment and Natural Resources, issued this statement that if current trends of population growth and coastal resource exploitation continue, that the availability and affordability of fish to provide a crucial protein source for the Philippines will be lost. That was said in 1999. At that point, there was also a very interesting fisheries expert, Dr. Daniel Pauly, who came up with a theory to how can we roll back overfishing. That's what he called it, rolling back overfishing. And he was a fisheries scientist, and he identified three things. And he said, one, we need to help the communities set up sanctuaries where the stock can regenerate, and they will promise not to fish in that area for 3 years until the stock regenerates, and then it'll spill over and they can fish around the perimeters of these sanctuaries. And then he said, of course, we have to educate them about the value of coastal resources and why they should protect them. And the third thing he said is we need to strengthen family planning, because even as a fisheries scientist, he saw that there were too many fishers and not enough fish. So he recommended that way back in 1995, and nobody really acted on that. And certainly the government agencies that could have made it happen didn't get together to make it happen. So those were the factors that we took into consideration when we designed our integrated approach. And this is a conceptual framework that tries to be a graphic presentation of what are the environment and population dynamics and the social dynamics that are going on in a given situation or area. So these are the dynamics going on in the coastal zone. And the situation on the right is our vision. What we would want it to have is improved human and ecosystem health for better food security. And as you go to the left, the risks or the threats are identified in the box. And the further that you go to the left, you get into the indirect threats, and the ones on the right are the direct threats. So we tried to work it back. It's a kind of a root cause analysis. And in the process then, we identified 3 of those factors, or 4 of those factors, that also represented opportunities for intervention. And those are the black boxes. And they were opportunities that an NGO working with communities and with local governments could possibly impact. And they were the lack of access of family planning in areas of high marine biodiversity, some traditional preferences and beliefs. One was this desire for more children, and it's because they have no other livelihood opportunities other than to fish. So the more children you have, the more hands you have to help with fishing. So there was this sort of built-in preference. And also, of course, there's some preference also for males over females. You have that. So they may already have 5 children, but they still want that boy, so they keep going on. The lack of alternative livelihood is and that's why there's also so much poverty there, because when the fisheries collapse, then they're driven further into poverty because they really don't have any other skills and they don't have access to credit. So we saw that as something that perhaps we could intervene. And then very weak enforcement, where the local governments were not enforcing laws that are already in place to protect the habitats. So those were the opportunities then that we designed the integrated approach around. And just very briefly, we like to call it an approach rather than a project, because it's an approach that once we introduce and communities pick it up, they carry it on and they sustain it. So it's not like going back to see if every element of the project is there. If you go back, what you will see is this integrated approach still being carried on by the communities. It uses this symbiotic strategy to link the sectors. So the 3 sectors that we're linking are the health, population and health, the environment, and the economic development sector. It focuses on food security from the sea. So this is a concept, food security from the sea, and it's going to be important later on when we talk about how we evaluate this. We didn't use traditional food security indicators. We used the ones that are used in the Philippines when they talk about the food security from the sea. The program targets, of course, fishers, which are both men and women, women living in coastal communities, because they are the ones that don't really have any access to alternative livelihood training or microcredit. And then the youth group, and I explained before why we're giving emphasis on youth. And of course, living in what we call this high growth, top priority marine conservation areas. So that's in a nutshell the focus of the project. Very quickly, the goal was to improve the quality of life of fishing dependent communities while at the same time maintaining the diversity, the productivity, the integrity of those life-sustaining coastal habitats that they depend upon. So it had two goals, simultaneously trying to impact both of those. And by the way, we were trying to just maintain the status. We did not expect that we were really going to be able to improve it, because it's hard enough just to maintain it with all of the loss of biodiversity that's going on, even with the best protective management interventions. We said we will be satisfied if we can maintain the conditions of these coral reefs and mangrove over a period of 6 or 7 years. The specific objectives then were to improve reproductive health outcomes in these communities, and we selected that because our baseline survey showed us that women here have 6 or 7 children, high rates of infant mortality and maternal mortality. Most of those women did not want to have that many children, so there was a huge unmet demand for family planning. We wanted to build the community capacity to implement these coastal resource management interventions and approaches, not to just be dependent on the government. And this is what we also found, that they all thought that the government was supposed to be the one to go in there and clean up the coast and do the protection, and they didn't really even realize that there were things that they could do. So the whole idea of building their capacity. And then we wanted also to increase community and policymakers' awareness of the linkages between these population health and environment and consumption factors, and garnish their support for integrated approaches. So those were the 3 main objectives. The intervention mix, now what I'm going to present to you is what the comprehensive program does. And this is the program that we have rolled out in over 1,000 fishing villages. Later on, when I talk to you about the evaluation has to looks at just one sectoral strategy and 2 sectoral strategies and the integrated approach. So an integrated approach includes these 4 main components. One is this community-based family planning, and that's a picture up there of a fisherman and his wife. And his wife is running this little shop. She already had the shop. Sells soda and cigarettes and liquor. And so it's an existing outlet, because there's no institutions when you get down to these little hamlets. There's no clinic that we can work out of. The only thing that's there is this little sari shop. So that becomes the outlet for distributing condoms and pills. And she becomes the peer educator, and she receives training in how to educate women about family planning options, how to screen them to make sure it's safe for them to use pills. And her husband happens to be the one of the ones who guards the fish sanctuary that's set up. So these are called couple peer educators, and we use this peer education approach. We also have youth peer educators, and that's what that's one of the drawings the youth peer educator did. And they're promoting both responsible sexual behavior among young people and to become a steward of the environment. So it's a combination of becoming a steward of your sexuality and of the environment. And that's what the youth peer educators learn and pride themselves on being. The CRM component on the right-hand side, and this is actually an island, and there's a sanctuary in front of that island from the project. And that's looking to protect habitats, and there are other strategies in coastal resource management that I'll tell you that component does. Every component, whether it's reproductive health or the conservation, has a policy advocacy piece, and it's tailored to what that is. So in family planning, we had to convince the mayors to let us do community-based approaches, because as I mentioned to you, it's actually not done on it's not authorized to be done at a national level. It's not part of the Department of Health's policy. But if the mayor says, yes, you can do this in my municipality, then you can do it, even though it's not part of the national program. So we had to do that in order to be able to to do a community-based family planning strategy, we had to have a written agreement with every mayor that we had that we could do it. And we also got them to co-fund it because we didn't have the resources to finance all of these elements through the project. Every component has a small enterprise development and a microcredit component. Now that's usually linked with coastal resource management, because if you set up a sanctuary and you tell fishers you can't fish there anymore, they don't have any way of feeding their family. So you have to bring in alternative livelihood and microcredit when you're doing a CRM approach. We felt that we wanted to do it in all the areas because these are all extremely poor sites where we did the study and the project. And we also didn't want to bias the study by having only one area that had microcredit and economic development, because that could influence all outcomes. So every component then had a microcredit. And this is where Tom Outlaw and USAID really helped a lot in providing funds in the site where we were doing the family planning to also have training for women and youth in environmentally friendly small enterprises. And that's important in the coastal zone. You can't just come in and introduce pig raising, for example, and then all of a sudden they start polluting the coastline with wastes from piggeries. So it had to be environmentally friendly wherever we worked. So quickly, I told you already that family planning interventions use these community-based distributors, and this is another little Sari shop, and you can see there's advertisements for Tenkei liquor, and there's also up there it says community-based distribution outlet. We provide basic family planning services. And there's another poster of a woman's face over there that says, if you don't want to be pregnant, come and talk to us. So this is how you do community-based family planning. We also had to have a referral mechanism, though, because these women and men, of course, they can, if someone wants to have a permanent method like a vasectomy, or they want an injection, or they want an intrauterine device, they've got to go to the clinic. So all of these community-level peer educators are linked through a mechanism to refer to a government facility, which is often at a higher level, at a district level or whatever. And then we found that we actually had to retrain all the government workers at that level because they didn't have up-to-date training in reproductive health. So we had to do a whole component on strengthening the referral mechanism. And then there are youth activities. And here, the young people were doing a lot of the public education campaigns and using traditional media like community theater. And then I mentioned the microcredit already. The CRM interventions, again, we had to do a lot of advocacy with the mayors because we purposefully are going into areas that still have some intact ecosystems. We didn't want to go into places that are already destroyed, and then we had to make investments in rehabilitation, which is much more expensive. So we were working in these areas that still had maybe 20% coral coverage. And the mayor would say, well, you know, our place is good. We don't need to do this yet. And we said, well, prevention is, it's time to do it now when you can still only make an investment in prevention. So there was a lot to do there. Most of them didn't even know what coastal resource management was. And then in order to set up a sanctuary, you have to have a legal 10-year-old agreement. There has to be an ordinance passed by these mayors. So sometimes it took almost 2 years to even get the legal agreement before we could set up the MPA. So it takes a lot longer to get these conservation mechanisms in place than the family planning mechanisms. And then in some places there weren't laws that banned the use of other destructive gear, so we would also try to get them to pass some laws on that side. Then we have to educate the communities because they're saying, like, why do you want to cut off our fisheries? You know, you mean we have to take this many hectares of the ocean and we're not allowed to go in there? So there's a whole education process before the communities will buy into this. And if they don't buy into it, it's not going to work. Even if you put ropes around and you got people guarding them, they still get in there. And so there's a lot of groundwork that has to be done to get the local governments to buy in, the communities to buy in. And one of the ways that we get the communities to buy in is we do these things called participatory coastal resource assessments. And we actually bring fishermen and with snorkeling gear and teach them how to snorkel and go around and take a look at the coral and what's there, and mangrove, go into the mangrove. And they've been in there, but they don't look at them necessarily from this more planning, how can we conserve this and look at these valuable things that we have. So but that gets them to buy in. And then also we get the community to nominate people who are going to be the ones to manage this sanctuary. Once it's set up, the community has to manage it. And they have to periodically monitor and see if the coral are coming back, if fish are coming back, and they're taught simple ways to do that. And finally, they have to patrol it. They literally have to get volunteers in the community, and they're trained, and they're called fish wardens or bantay dagat, and the local government deputizes them, so they have the authority to arrest. If somebody goes into that sanctuary, they have the authority to arrest that person, bring them into the mayor's office, and that person can be put in jail. So there's a lot of training and social mobilization that goes in setting up these community-based coastal resource management arrangements. Youth activities here were also, we did youth camps, and you can see the children there are young people, 15 to 19 is the target group, are learning, they never snorkeled, they never saw a fish underwater, even though they eat fish all the time. And this was partly how we got them involved in helping to monitor the sanctuaries. And that's a guardhouse, so there's a guard that stays there all the time and looks out over the sanctuary. And they have lights at night if they suspect or hear somebody to see if somebody's coming into their sanctuary. So how do we get this integration? We got this family planning going here, and we get this conservation work here. Where do we integrate it? And this is where we hypothesize that we're going to get some synergy if we can get this integration to work. So we integrate it in our behavior change communication messages. We do, as I mentioned, a lot of this information, education, and communication. So we integrate this, and I'll just give you a simple message, something like, to improve food security, we need to protect our precious coastal habitats and plan our families. So that's an integrated IE&C message. And those messages are pre-tested, and they're translated into the local language. And we have contests where we have the villagers come up with slogans and give awards for the ones that can communicate it in a most persuasive way. Target groups, as I said before, will have couples in the same household. One is the family planning field worker, outreach worker. The other one is guarding the sanctuary. The youth one is also doing the coastal cleanups and is a youth peer educator on adolescent sexual and reproductive health. So it comes together there. Also in our policy activities with the local government, and we sponsor workshops to help them develop their annual development plans, and that's the time when we help and encourage them to put both coastal resource management and family planning into their development plan, and we do that at the municipal level. So we have this approach now into municipal development plans and in village development plans, and that's how we institutionalize it, because once it's in a plan, then it's eligible to be funded from government sources that come from their internal revenue allotment. So it's very important to get these into the development plans if you want this to be sustained when the project leaves. So that's another way that we get some integration. And then we also, the way we did it is in service delivery. We had one environmental NGO that learned all aspects of this and was the team that delivered all the services. I mean, there are 4 or 5 people on this team, but it was another way that we could make sure that we were getting the integration. So now I'm going to go quickly as to how are we measuring the integration or the synergy. And this has never been done before. There's never really been any studies that really tried to answer this question. We're going through all this extra effort to do this in an integrated way. And are we really going to get some synergy, and are we going to get some added value? Because that's what we're looking for here. So we did it by testing our central hypotheses that there will be a statistically significant improvement in coastal resource management outcomes and reproductive health, family planning outcomes by delivering these services in an integrated fashion, as opposed to delivering either intervention in isolation. So to test that hypothesis, we use a quasi-experimental evaluation design, and the statistical tools that we use to test the hypotheses are called the difference in difference approach and logistics regression analysis. Quickly, what we had to do then is we have to choose one island where we're only going to do the reproductive health side, another island where we're only going to do coastal resource management, a third island where we're going to do both in an integrated fashion. And then we actually had a fourth island that was a control area where we didn't do anything. Unfortunately, the control got spoiled in the 6-year period of the study, and another group came in and introduced an integrated agriculture and family planning project in coastal areas for food security that basically changed a lot of the conditions there, and we no longer had a control. But we were able to still, in analyzing the data, use one site against the other as a control, and I'll show you how we did that later. We worked in northern Palawan. So here's the Philippines, here's the island of Palawan, and this is considered the fishbowl of the Philippines. It has been for years. And the very northern part of it, which is over here, is one of those areas of extremely high marine biodiversity, and that's why we selected the area. We did not do a random selection on these sites. We were driven by, basically, the government told us where we could work and where they wanted us to work. So the Calamianan Island Group, Conservation International had done some survey work there in 1999, and we knew that there was pretty good conditions in the island ecosystems. So this island here, Busuanga, is where we implemented the reproductive health component only. This island, Culian, which is a separate island, separate local government, we did the integrated approach. And out here is where we did the coastal resource management only approach. Now, how did we decide to do that? We did a baseline biophysical assessment because this area had never been surveyed before. And there had been a little bit of surveying here and no survey here. So we had to have a team of scientists, marine scientists, that we retained to go out and do that because Path Foundation Philippines does not have that expertise. And they surveyed around these areas. And they said to us, all right, there's a coastal area off from this village that has high fisheries value. We recommend, but it's already showing signs of stress from human pressure. So we recommend that you do a sanctuary here. They identified places where had high fisheries and high ecology value or high tourism value or a combination of the three, and they recommended where, and we followed their recommendations. The other factor was if there was an NGO that already operating in those locations. And one of them had no NGO whatsoever. Another one two of them had no NGOs. And only one had an NGO that had already been working with the communities. So we had to bring in local NGOs into these areas. And we couldn't go too far away. These are very remote and hard to reach. So the selection was also based on the availability and what the NGO wanted to do. Some of them really didn't want to do an integrated approach, but they felt comfortable in doing the conservation. So that factored into the solution. Now I'm going to talk quickly about what were the dependent variables in the study. And we basically had a set of reproductive health indicators. We started off with literally scores of indicators that we tried out in the baseline survey. And over the course of the study, they got narrowed down because, one, we found the local surveyors and couldn't collect the data on some of these indicators. Very hard for them to get data on unmet need for family planning, for example. We were able to do how many children ever born to a woman. We were able to get reliable data on that indicator. whether they were currently using a family planning method, very hard to get information from young people on their sexual activity too. So it came down to the set of indicators that you're going to see here, what we were left with in the end after testing a lot, and also on the proxy indicators for food security. So here's where we were looking more at the CRM framework for food security. So we're looking at, is a household totally dependent on fishing? That's a food security risk if they have no other way of making income. So percentages of households that are totally subsistence fishers was that indicator. Did they know someone? Actually, we don't ask them the last time you went fishing, did you use dynamite? Because of course they're not going to tell us the truth. But we ask them, do you know anybody personally who uses dynamite or uses cyanide? Cyanide is another poison they use to catch fish. And that kills, is even more destructive than dynamite, and it really kills the coral reefs completely. So if we can have an impact on reducing use of dynamite and cyanide, we're going to improve food security at the household level because we're going to be protecting the habitats and ecosystems. On the CRM indicators, we chose biophysical parameters for coral reef fish and mangrove, and these are interrelated ecosystems, and they're what are producing the fish that people eat there, and are essential to have good coral coverage. So we had live coral coverage, coral mortality index, and then some indices for coral development, coral condition, and coral succession. For the reef fish, we were looking at species richness for all species and specific target species. The biomass, size frequency is very important. And then on the mangrove, we had several indices for volume, density, mean density. Our methods then, we had to do a pre-intervention survey, both household surveys and biophysical surveys had to be done before the interventions were introduced. And then we did them 6 years after. Actually, we did them 4 years after, and it wasn't enough time to show impact. So then we had to do it 6 years after. I'm only giving you the data from the pre and post. There's not a whole lot of difference other than we have more impact when we waited the 6 years to get the post measurement. We used, University of the Philippines has some pretty excellent research groups. So to do the community household surveys, which were gathering the information on family planning, socioeconomic data, some fisheries data too, we used the Demographic Research and Development Foundation that did the baseline. And then there's another institute that also does health research called FACE. They did the post-project surveys. The biophysical surveys were done by the Marine Environment and Research Foundation, which is part of the University of the Philippines Marine Science Institute, also under the bigger UP umbrella. They did both the pre and post surveys for the biophysical assessments and the analysis. Community surveys, I'm just going to do this really quickly. We had 9 villages we selected in each of the sites, and they were randomly selected using the probability by proportional size. Then they had to do a complete listing of every household in those 9 villages or barangays. And then from there, they drew their sampling frames of different populations, and we wanted both adult population and youth population. And then they did a sampling of the individuals using random methods. And then once a sample of households was selected for one age group, the members of that household were no longer eligible to be interviewed for a succeeding age group. So there's no overlap because the age groups do overlap, but the respondents don't. And then we had separate samples for the baseline and the post, meaning we didn't go back to the same households in 2007, the exact same households that we went to in 2001. And that's because we wanted to have a snapshot of the conditions before and after in those populations. Just quickly, these are large sizes. We have 400 households in each of the experimental sites. we had 100 adults and 300 youth, so also 400 respondents in each. So it's pretty robust sample size. For the biophysical surveys, they sampled the shallow coastal habitats within the jurisdiction of the local government. And these were coral reef, as I mentioned, reef fish and mangrove. And they did a resource and ecology assessment methods. For the coral, they did what's called line intercept and video transects. These are underwater methods. Also for mangrove, they did transect line plots. For the fish reef, they also did it along the same transects they did the coral, but they did what's called fish visual census, and my daughter Heather can tell you more about that. She knows how to do that method. With the biophysical, they did go back to the exact same coordinates in the same transects using GPS. So there they were going right back to the very place that they surveyed in 2001. The statistical methods they used were both the bivariate analysis and the multivariate analysis. For CRM, they used what's called ordinary least square regression analysis to determine the spatial temporal trends. These are trends then. And a software package that's called PCORD, I couldn't tell you what that is. And they did the significance testing to the 0.5 level, 95% confidence level. For the reproductive health and food securities, they used both the OLS and a probit regression analysis model. I'm not going to get into that in detail, but I have the details if anybody wants. But that will give you the difference in difference. So, because now we're going to be comparing these interventions, and we need to be able to come up with a test of significance when we compare one against the other. They used data to analyze the data, and at a 90% confidence level. There are also the independent social variables that had to be brought into the analysis, and we had to create some of these indices. The wealth index had to be created. The others are pretty straightforward: age, education. These are factors that we know have an influence on reproductive health outcomes and other social economic outcomes. So they were brought into the analysis. So now I'm going to get quickly to the results, and I'm not going to put up any tables because these are like coefficients and they're very difficult, but I have the tables if anybody really wants it. I'm summarizing it for you. So when we looked at the integrated intervention versus the standalone interventions, we found that what the data shows is that the integrated interventions generated the desired impact, and by this I mean either more women using family planning, more young people having protected sex, or more young people waiting to have sex until they're older, or fewer people using dynamite. That's what I mean by a desired effect. So the integrated approach generated the desired impact on all 9 of the reproductive health and food security indicators. It exceeded the impact of the other 2 sectoral interventions on 5 of those. And for the other, it performed equally well. So here's how we can summarize it from the multivariate regression analysis. And this is the difference in difference. So in fact, like in the reproductive health only site, even though it's not highlighted, they had a statistically positive trend. And so did IPOP Corn. But then when we test, we do another level of testing to see which is had more impact, which had more power to it. That's what this tells you. That's the difference in the relative impacts. So that's how we can say. So these were also positive and statistically significant. But then in comparison, when we run that 3rd level of statistical test, the integrated approach came out on these indicators as having a more powerful impact. For the CRM, then, they had 18 indicators. And this is just summarizing it. The integrated approach there was no change in 14. And actually, no change is okay, because that means we've maintained the condition that parameter is measuring. So we maintained in 14 of those indicators. We had 3 statistically significant improvements, and they were in coral and mangrove. and we only had one decrease, and that was in one of the mangrove indicators. By comparison, the sectoral approaches each had 3 statistically significant decreases in an important indicator and only 1 increase, and this table summarizes that. Because there was not a situation here where we had 2 sites where they both had the same positive trend, we didn't have to do that 3rd level of testing to see which had a more powerful impact. So this didn't go into as many steps in the analyses. We also had data on the cost, and so we did a cost analysis. And this chart shows you that the cost to implement the integrated approach, which is X1, the total cost was about $219,000 US over the 6-7 year period. That the family planning one only cost about $105,000, and the CRM only cost about $145,000. To do this comparison, then, what we do is we add the cost of the 2 sector interventions, and that cost came out to be higher than the cost to do the integrated approach. And I think the savings is really more on the reproductive health side, because in looking at how this money was spent, we see that almost equal expenditures on the CRM component in both the integrated and the CRM sites. So to kind of the conclusions we came up with is that overall, the IPOP-QORM intervention generated a greater impact on the majority of the indicators used in our analysis to measure improvements in human and ecosystem health and food security from the sea, recognizing that there is a limited number of indicators here. And these data support our hypotheses that integrated approaches yield higher impact than sectoral approaches. What are the implications of this? It's going to be difficult to ensure long-term sustainability of coastal resource management and to prevent overuse of natural resources unless integrated forms of management, coastal management, are combined with family planning, are delivered in a simultaneous way. And we feel that the IPOP-QORM we've demonstrated that this is a cost-effective approach to obtain those kind of synergies and maximize the impact of those coastal resource management and family planning interventions. What do we think made the difference? Well, in fact, most of our indicators that really showed high power with the youth. And we think that our approach of encouraging young people to become the future stewards of the environment, but also to honor their own bodies and become stewards of their sexuality, we think that went over really well, and it resonated with young people. And then when we went to the community and asked them for feedback on it, what they told us is they like the integrated approach because it's more like how they lead their lives. They don't lead their lives in sectoral ways. They lead integrated lives. So they thought that we had better community participation because it was just more along the lines of their lifestyle. So just a couple take-home lessons, I think, that come from the overall program, too, not just the operations research, is we feel that the integrated approach, or the synergistic approach, lends sustainability to conservation interventions, while the conservation side provides that comprehensive context for residents in coastal areas to recognize the necessity of limiting family size in order to achieve food security and to improve family welfare. And the other lesson is that with appropriate training and support, environmental NGOs can develop the capacity to implement community-based family planning activities. This is something that people didn't think was possible, and I think that that's a really important lesson from the study. A lot of limitations of this study. There were introduction of certain activities in some sites that we could not possibly control for. The level of penetration of the interventions is an important thing, and that varied from site to site, as well as the maturation of the intervention. And as I told you before, it took 2 or 3 years to get a permit to even set up the fish sanctuary. So actually, the CRM results are only maybe after 24 or 28 months of protected management. and that varied across the sites, and the performance of the NGOs who implemented these approaches varied, and the commitment of the local government varied. So there were things that we just couldn't control for in that regard. I hope I left time for questions. Thank you very much for your attention.
Thank you very much, Leona. There's obviously a lot to this approach and the experience that you all have led in the Philippines. And it's tremendous to have the data. I've gotten official permission from our webcast people that we have a little more time than we perhaps formally set aside. So why don't we open it for discussion? As I mentioned, please allow one of my colleagues, Sean or Rachel, to come to you with a microphone and tell us who you are before you pose your question. Bob Goodland right there. Yep.
Thank you for a very interesting talk. I enjoyed it greatly.
Thank you.
Thank you for coming. As I remember, you didn't actually mention mining and deforestation. And I just finished a book on the Philippines, and we identify mining and deforestation as the biggest, or one of the biggest impacts on rice and cage fish, delta fish, estuary fish, fish tanks, fish traps, and coastal, particularly the cyanide, to lesser extent mercury. Have you got any comment on that?
Yes, I'm glad that you brought that up, because also southern Palawan is an area where there's tremendous amount of mining, and that's why we didn't choose that area, because almost all of the coastal habitats have been degraded from the slush from the mining that's going on. And deforestation, yes, that's a well, Palawan, is I didn't mention this, but it's a special protected area. So haven't had as much deforestation as in other parts of the Philippines. But Conservation International has really done a tremendous job of mapping the deforestation that's gone on throughout the Philippines. And we did have incidences in our sites where there was a lot of mangrove deforestation, because they convert the mangroves to fish ponds. And we were having to reconvert them back again because the fish ponds are not successful, and then they've lost the surge protection of the mangrove and the nurseries, advantages of having mangroves. But as I mentioned before, we purposely chose sites that were somewhat remote and that had not had a lot of serious deforestation, and they were definitely not mining areas. What did happen in our site was we had the live fish trade, which is a lot of the demand coming from Hong Kong, and that's how a lot of the cyanide entered and started to be used in our area, and that was a commercially driven threat. But I'm glad you raised it, because and I'd like to know more about that study. Actually, I hadn't heard about that.
Let's do just Judy, and why don't we gather a couple, because there are a lot of hands, and then we'll come over to this side. The gentleman here.
Thanks. This is really great, and it's fantastic to see some concrete evidence at last that the integrated approach, really does bear fruit this way. Just one question, and a lot of the projects that we work in are at a different stage in development, but very often we find that we have to bring in other health services as well as just family planning. People aren't necessarily at a stage of wanting to limit their families because they have a lot of children dying and so on and so forth. And obviously the Philippines is a bit more advanced. But given that you were working in very remote areas, did you get that request for basic health services as well as
I'm glad you raised that.
Can we get a couple, because we got so many
Okay,
questions. If you could just make a note of Judy's, and we'll just right there. Because I want to make sure everyone gets a chance.
Hi, Larry Hausman from the Nature Conservancy.
Yes, good, Larry.
I have again a tip of the hat for the work here. I think this is it's really important for the community to see that this kind of approach actually has legitimate on the ground impact. I guess my question had to do more with the kind of nuts and bolts of this, and that is this seems to be the whole way you went about this study and the areas that you got involved in seems to be pretty technically intensive in terms of how many people you have to put on the ground, things like who implements the microcredit elements of this. Could you just give a little feel for how many people are involved, given the seems a fairly limited amount of money that was actually put toward the program?
Yeah. Okay, I can do that.
Actually, we've got a mic close at hand. Sean, why don't you go do that, and then we'll come over in the middle. Yeah.
I'm from the Philippines.
If you use the microphone, sir.
I'm from the Philippines, and I'm one of those
Fisher
I
family.
live in that area. I mean, I live in that environment you're studying. I grew up in that environment. I would applaud your experimental approach to the study.
Thank you.
I think the null hypothesis that the integrated was better than the sectoral was okay. I know when you conduct an experiment, you're limited by resources. Well, I'm just questioning about the choice of experimental site. Would that be applicable to other sector, to other Philippines at large?
Okay, good.
But anyway, I really applaud the experimental approach that you use, the statistical analysis, the methods. But if you could have more sites all over the Philippines, then I think it would results be more, I think, applicable to other parts.
Okay.
Different cultural values in different parts of the islands would affect,
Okay.
like
Thank
mining, you mentioned.
Okay.
Perfect. Why don't you take those three, and then we'll
Yeah,
start with
if I
Jason
can.
and come back
Yeah.
in.
Judy's question, good one. Yes, we did have requests for other things, and the main thing is water, because a lot of these islands have no fresh water, and they actually have to take jerry cans and go to another place and come back with fresh water. And the way we were able to respond through that was through our microcredit component. So they actually started small businesses bringing in fresh water, and that was great, met the need there. The other thing that emerged was a CRM strategy has 8 strategies in it, coastal resource management, one of which is tourism development and ecotourism development. And all of a sudden we realized that that's potential for the transmission of sexually transmitted diseases and HIV/AIDS. So we actually brought in AIDS education and STD referral services because it became a problem, not in the research sites, but in the other 33 municipalities where we've done this work. And we promoted ecotourism as an alternative livelihood for these communities. You know, there became that concern about HIV/AIDS. So water, and I would say sexually transmitted diseases was definitely a priority. The nice thing is when you're promoting condoms for family planning use, they also prevent sexually transmitted diseases, and we were able to do what's called dual method, promote the benefits and dual method. Next question. Is that okay, Judy?
Yeah, that's
Is that okay? Thanks. How many people involved? You know, we didn't give these NGOs large grants to do this. So an NGO that implemented an integrated approach like that had 5 outreach workers, full-time outreach workers. These are they're paid at a level of maybe $500 a month, $400 or $500 a month. But we use this cascading approach where every paid outreach worker identifies 10 volunteers in the field, peer educators or whatever they were, and they mentor them. And those volunteers get training. They don't get paid, but they have other incentives in the program. So that's how we were able to develop our labor force in the communities, was basically having one outreach worker responsible for identifying, training, mentoring, following it up, working together with at least 10 in a village. And then there was, each NGO had a part-time field supervisor and a part-time project director. And our agency, Path Foundation Philippines, we provided all the technical support. So we had 15 NGO partners. And we were the ones that standardized the provision of the reproductive health technical assistance, the CRM technical assistance, the microcredit assistance, the facility, the funds itself. They used all standard indicators. Even though we didn't do this level of research in every site had what we called a program monitoring system, and we do have data from every place that we worked. Not as large a sample as this, but every NGO was taught how to do simple program monitoring in their area. So maybe one NGO had 7 full-time equivalent people, maximum. And they were covering fairly large population sizes, but focused on a particular ecosystem. So they were not covering the whole municipality. They were looking at the Bohol Marine Triangle, a certain component of that they covered. So it was very focused in that way. Also, Dr. Angel Alcala, do you know him? Dr. Alcala, he used to be the minister of the Department of Environment and Natural Resources in the Philippines and one of the leading marine scientists. He's on our board, and his local NGO also implements this approach, and they also have their own research, and they've done similar kinds of analysis, and he's getting ready to publish his, and it shows similar impacts and comparative advantages in the sites where he works, which is Camiguin and Dawis. Those are the two areas that he does his research.
Oh, sustainability of your interventions. Methods were good.
That's a good question.
Sustainability.
Yeah. There are a couple of mechanisms. Firstly, those family planning products are not given away for free. They are sold through those little outlets. The sari-sari shops sell them. So using a social marketing approach. When we first started, we subsidized. But then later, we brought up the price to the actual price. So social marketing is a cost recovery mechanism that builds in sustainability. Later then, the NGOs, we also got them a franchise with the National Social Marketing Program. So every NGO now is a franchisee, and they actually do make some money from the sales. And now we're doing it with the local governments because they're not getting contraceptives anymore in the Philippines. So now the mayors want to do this, and we're working directly with the mayors, whereas before we worked through NGOs. We're doing this scheme now directly with the local government and making them a franchisee also. The other sustainability thing was building it into the plan. Remember I told you there are these development plans. The municipal 5-year development plan has family planning and coastal resource management in that plan. And then that's eligible then for the government money to fund those activities. So once it's in a development plan, they can tap.
I think the private sector is more reliable. Government officials change.
Yeah. But these little shopkeepers are the private sector. They're all private entrepreneurs.
Private sector.
Yeah, that's
Okay,
good.
why don't we get Jason, Hannah, and then come over here? Yeah.
Thanks for these questions. They're making
Thanks, Leona.
me
It's
think more.
a great look at a very interesting project. I guess I'd challenge you or ask you at some point to report a little more on the results with the community-based coastal resource management institutions that you created. I don't know if you, in all cases, had to create those or if you were building on existing groups in some cases. There's a really rich literature on common property, coastal resource management, and there's very little work on how population growth and changing socioeconomic conditions is going to affect the long-term sustainability and viability of those institutions. So it would be really interesting to include, I don't know if you collect the data, but indicators on the groups themselves, how they're functioning over time, whether or not their structure is improving, getting worse, because in other environments, as the population, the number of fishers increases, these institutions tend to lose resilience. They tend to fall apart.
Just answer this one. That's a good point, Jason. The institutions we did work with are called people's organizations. So people that use mangroves, so these are the resource user groups. They actually become registered locally as an entity, a nonprofit entity, and they're called people's organizations. But they're all people who are either fishers, there's fisher folk organizations, mangrove users, gleaners. Those are the institutions we work with. We do have program monitoring data on that, but it doesn't lend itself to this kind. But you're absolutely right. We need to bring in that also into this analysis. And the paper that we're preparing for publication is going to bring in some of those other indicators and findings. The function, whether they're functioning and improving the function, is important. We had to actually strengthen them. They were there, but most of them were not doing much, and we had to spend a lot of time strengthening them. they were actually the ones that ended up managing the microcredit facility. So we did a lot of training, and they actually got to retain any profit. They decided how much interest was going to be charged. They had to return the capital to us, but they got to use the capital for 3 or 4 years, and they got to keep whatever interest they charged, and the group set that rate. We spent a good year training them in that. But that's something now they have, and that strengthened their institutional capacity. We did have to create some in other places, and particularly the ones that are managing the fish sanctuaries and the mangrove sanctuaries. They were called the management committee, but now they've become their own organization so that they can tap into government funding. Because if they're legally registered as a community-based organization, they can be eligible for funds that are set aside. The local government sets aside development funds. So that's why they become legal entities. So we have data like on how many of them became legally registered and how much money they've been able to leverage from the local government for the IPOP Quorum activities. But those kind of data are tough to put into just kind of an analysis. Yeah.
Hannah?
Thank you. This has just been super compelling and really exciting, and has also sort of raised some issues. Oh, my name's Hannah Fairbank. I'm with USAID. Some challenges on the donor side, working with strictly earmarked funds, and oh my gosh, how do we promote integrated approaches in this type of environment? But that's my own issue to deal with. I have sort of actually two questions. One is leading off of the question of the gentleman about land-based threats and land-based sources of habitat destruction. And I guess I'll just ask that one first. Do you see this model, or at least the CRM methodologies? You mentioned there were eight sort of models. Is it able to address any of these more land-based kind of ridge-to-reef landscape issues that obviously have significant impacts in the form of siltation and other impacts on the reef? So that's one question. And I guess my other question is, it seems like the Philippine culture really lends itself very well to this model. I mean, it's obvious that the model has been impacted by the culture, taken advantage of attributes of the Philippine culture, in terms of community organization, in terms of level of civil society, in terms of just general enthusiasm in participation at the community level and getting these 10 volunteers. And in general, it just seems like it's a real strength of the program and kind of perpetuating the strengths of the culture. But I guess my question is, especially where it comes to the population interventions, did you all come up against challenges in terms of the cultural acceptability of women actually using family planning methods? In my experience, that's one of the real challenges, is the lack of empowerment of many of the women in these communities, where even if they wanted to have fewer children, the husbands wanted more children. They weren't able to avail of products that were readily available in the community because of some of those cultural norms. And I'm wondering how the program dealt with those and addressed those issues.
That's 4 questions. Let me just go really quickly. Number one, the model was actually tested in a terrestrial area by one of the mayors who was part of our program, and he loved it so much. He took it into an upland area related that was having an influence on the coastal. He called it IPOP norm, integrated population and natural resource management for terrestrial areas. So it is replicable. And actually I'm working in Nepal to replicate the same approach with forest communities. So a little bit different mix of interventions. So you have to do that conceptual framework first and see, what are the key things that you need to focus on. In Nepal, we're getting synergy by, trying to reduce consumption of firewood, improve the use of better kinds of cooking stoves that don't use as much firewood and don't create as much smoke. And smoke is the main cause of pneumonia in children and respiratory problems in those households. And then the family planning. So it can be done, but you have to carefully look at what interventions you're going to mix. We had a lot of problems with the family planning. We had, especially from church groups, tremendous problems. We had one time a mayor came into one of our trainings. We were training on family planning and closed the training down and said, you cannot train my people in condoms. You cannot have condoms here. And how we got around that, because then she was very influential and she was in the League of Mayors and was talking to other mayors. We sent her off to Thailand, and we had Michai give her an indoctrination on community-based family planning and why family planning, it can help other things, and it's important for economic development to have family planning. And that we still send groups of mayors to PDA Thailand to get that orientation, and it worked. And she's now the biggest advocate of the program. She is. She's one of the most vocal advocates of the program. And she gave a lot of money in the program, counterparted a lot of money for alternative livelihood. Limited funding. I understand this sounds like it's a lot of money, but I'm in the process of writing a manual now for USAID, and I want to call it Where There Is No Donor, because you can do integrated approaches. Don't think of a project, but even if you have an ongoing project, there's an opportunity to do something in an integrated fashion, which could be an integrated pop environment or pop health environment. It's a lot of resource leveraging and identifying resources that are out there and finding out ways to link communities to it, and then leveraging, a lot of leveraging. We did with Packard, I think, for every dollar of Packard's money, we leveraged 60 cents in resources from local communities, local government, NGOs, people's organizations. We track that. So I don't be put off because it sounds expensive. Did I answer all of yours? Getting around the issues with the church were very difficult. And also the parents were not too happy about us teaching sex education to young people. I've sat in focus groups with whole communities of parents talking this through with them. And it was so great because, the leader of the community would say, I'm not letting this program come in and tell my kid about condoms and sex. And another fisherman would say, hey, you don't think your kid sees porno? These kids have got access to video. They need to know this. So they would argue back and forth, and then they'd finally say, okay, you can do it. And we do it with the parents first. We actually did sex education for men because a lot of they're interested in Viagra and a lot of sexual issues. So we'd say, okay, we're going to talk about men's sexual interest. And then from there we would eventually get down to talking about protected sex and family planning. And we actually had exercises with men to do a family budget, because family planning is not just using contraceptives, it's planning your family. So we would have these exercises with the men. How much does it, is it going to cost to have another child? And once they did the family budgeting, they kind of realized that they're not going to be able to afford another kid, and then they would let their wife use a method. So we had to develop a lot of those tools to get around some of that resistance.
This is just
Yes,
an
sir.
insight into the high fertility rates in the Philippines. Fertility rates. Well, sometimes for folks, after the lights are off, there's no electricity. So there's no other entertainment but you and your husband and wife, several
Exactly.
children, and you live in a fishing town,
Yeah.
Viagra.
Yeah.
You don't need Viagra in fishing town.
Yeah.
The seafoods are aphrodisiacs.
Yeah. Very true.
Okay, Rachel,
Yeah.
if we could go right over here, and then I think there's one more, and we'll take these two questions. And
No,
that'll have to
my
be it.
question was sort of answered. It was about the role of religion in that community and if there was any opposition from any of the religious groups and how you sort of got their buy-in. You mentioned buy-in from the mayors
Yeah.
and the youth. And
We actually had priests coming to some of our trainings, and they thanked us later, and some of the more daring ones would come for the sex education trainings and would later on support the program. There's only one time when some of our adult peer educators came and said, you know what, we can't be invisible with this because the church is going to take away the scholarship they're providing for my child if I continue to be a couple peer educator for your program. But we just want you to know that we're going to continue to talk to our friends and encourage them to use family planning. Those kinds of things came up. Yeah.
Hi, Leona. It's Carol. over here.
Oh, Carol, yeah, please.
I'm from USAID, and I was the former director of the Office of Population Health and Nutrition in the Philippines when Leona was actually hanging around there.
One of my mentors.
So I do have a question in terms of the results.
Okay.
You gave that nice table about the statistically significant trends.
Right.
And I noticed on the table there are some things missing that you were saying were your indicators. And of course, coming from the family planning side,
Yes.
not the coastal resource management side, two of the big ones were contraceptive use and children never born. They're not here. So does that mean that those weren't statistically significant in any of those areas?
What it meant was in both the area where we only did family planning and in the area where we did it in an integrated approach, both of them had statistically significant improvements in those indicators. So numbers of children ever born went down. Contraceptive use by women of reproductive age went up. But then when we tried to see whether they both were good, but then when we did the test to see whether one was better than the other, more powerful than the other, there wasn't a statistically significant difference at that point, that difference in difference.
Yeah.
They both were equally good. So that's why I said 4 of the 5 indicators, and these are the ones you're talking about, performed equally well. And then there was some that the IPOP outperformed the sectoral approach.
Great.
Okay?
Because this is a few years back, but we did a study of programs that did integrated approaches. The family planning is the outcome, not coastal resource management, not food security, not anything, just family planning. And we found that those NGOs that had a broader scope than family planning did not perform as well as those NGOs that were family planning NGOs that had experience at it. Other outcomes, such as employment and all this other stuff, may have been some beneficial impacts, but if your impact is family planning, then it was a wash. I mean, it was better
I'm
to
glad
stick
you
with,
mentioned that. Because we
stick
had
with
some
the family
NGOs.
planning NGOs.
We actually had some NGOs that we dissolved our partnership with because they said they wanted to do this, but actually they were just looking for money to do agrarian reform or their conservation stuff. So not all of our partnerships worked out well because we were real serious about if you want to do this, you've also got to do the reproductive health. It's real important. And you know what? Those conservation NGOs have come back to us and thanked us now because guess what? They're going out and getting money to do family planning, and some of them are getting money from USAID projects. They're conservation groups, but they're doing training in factories on about family planning and reproductive health. So all of a sudden they got other ways of raising money. And they also believed in it, and they took the integrated approach into some of their other projects as well. So they got a whole new capacity. But I think I can see what you're saying. That definitely did happen in some of our sites.
Judy, did you have a follow? I saw perhaps another experience on that.
Well, just really quickly, I think the main thing here is that conservation organizations are often working in this incredibly remote, inaccessible places that family planning organizations just can't get to because, it isn't worth the bang for the buck for them. So we're already there. We're already working with the communities. We have the links with them. Yeah. If we can just include family planning as one small component of everything that we're doing, it doesn't cost that much. Whereas to bring in a whole new organization to these areas would be, a much bigger operation. So I think this is our real comparative advantage in doing this is where in these really, really remote areas.
That's why we funded these groups in these remote areas to do just that.
Yeah.
It's still in terms of family planning.
Right.
Wasn't that spectacular?
But maybe you didn't give them enough support. No, they have to have a lot of technical support to do it well.
I know it's far more expensive, let's put it that way, than doing that.
Yeah. Initially, but once they get the capacity and the experience, I think.
Yeah. Terrific. Well, Leona, thank you so very much. You've given us an awful lot here, and we look forward to taking it forward. We look forward to the additional products that you'll be doing in